Energy drinks have become a pervasive part of modern life, especially among younger populations, athletes, and those seeking a quick burst of alertness during long work hours or intense study sessions. On the surface, these brightly colored, aggressively marketed beverages promise increased energy, improved focus, and enhanced performance. However, behind the flashy branding and bold claims lies a cocktail of health risks that are often overlooked or underestimated. Energy drinks are loaded with high levels of caffeine and sugar, a combination that can wreak havoc on cardiovascular health, disrupt sleep patterns, and provoke dangerous heart rhythm irregularities. The primary active ingredient in most energy drinks is caffeine, sometimes present in amounts exceeding those found in several cups of coffee. While moderate caffeine intake can improve alertness and mood, the doses in many energy drinks often surpass safe limits, especially when consumed rapidly or combined with other stimulants. Excessive caffeine intake stimulates the central nervous system and triggers the release of adrenaline, leading to increased heart rate and elevated blood pressure. For people with pre-existing heart conditions or hypertension, this stimulant overload can be particularly dangerous, raising the risk of heart attacks and strokes. Compounding the problem, energy drinks typically contain large amounts of added sugar, frequently 20 to 30 grams or more per serving, which translates into rapid blood sugar spikes. High sugar intake stimulates insulin production and promotes fat storage, especially when combined with sedentary lifestyles. Over time, this contributes to insulin resistance, obesity, and metabolic syndrome. The sugar load in energy drinks alone rivals that of sodas, yet consumers often underestimate their impact because energy drinks are marketed as performance enhancers rather than sugary treats. One of the most insidious effects of energy drinks is their impact on sleep. Caffeine is a powerful stimulant that can delay the onset of sleep, reduce total sleep time, and impair sleep quality. Many individuals consume energy drinks late in the day or in the evening to counter fatigue, unknowingly sabotaging their natural sleep-wake cycle. Chronic sleep disruption not only causes daytime fatigue and cognitive impairment, but also increases the risk of developing cardiovascular disease, diabetes, depression, and weakened immune function. The vicious cycle of caffeine dependence and poor sleep further perpetuates exhaustion and reliance on stimulants, trapping users in an unhealthy loop. Energy drinks have also been linked to serious heart rhythm disturbances. Several case reports and studies have documented incidents of arrhythmias, palpitations, and even sudden cardiac arrest associated with energy drink consumption, especially when consumed in excess or combined with other stimulants like alcohol or medications. The high caffeine content increases the excitability of heart muscle cells, which can trigger abnormal electrical activity. These irregular heart rhythms can range from harmless to life-threatening, particularly in susceptible individuals or those with undiagnosed cardiac conditions. Beyond caffeine and sugar, energy drinks often contain additional stimulants and additives such as taurine, guarana, ginseng, and B vitamins. While some of these ingredients have recognized effects on energy metabolism, their combined impact when ingested in large doses remains poorly understood and potentially hazardous. The lack of comprehensive regulation and standardized labeling means consumers may inadvertently consume unsafe levels of stimulants. Youth and adolescents are especially vulnerable to the risks of energy drinks. Despite health warnings, these beverages are widely consumed by teenagers, often in combination with alcohol or other drugs, which significantly heightens the risk of adverse cardiovascular events. Developing bodies are more sensitive to the effects of caffeine and sugar, and early exposure increases the likelihood of developing caffeine dependence and metabolic disorders. In summary, energy drinks are far from benign beverages. Their high caffeine and sugar content can elevate blood pressure, cause dangerous heart rhythm abnormalities, disrupt sleep patterns, and promote metabolic disease. Regular or excessive consumption of energy drinks puts individuals at increased risk of cardiovascular events, impaired cognitive function, and long-term health consequences. Awareness of these risks and cautious consumption, preferably avoiding these drinks altogether, is essential to protect heart health and overall well-being in a world increasingly dependent on artificial boosts of energy.